Hello, today I will talk about symptoms and treatment of coronary heart disease. During ischemia, an imbalance occurs between myocardial oxygen supply and demand. Ischemia may manifest in any of the following ways. 1. Anginal chest discomfort. 2. ST segment deviation on ECG. 3. Reduced uptake of tracer during myocardial perfusion scanning. 4. Regional or global impairment of ventricular function.
In the presence of coronary obstruction, an increase of myocardial oxygen requirements caused by exercise, tachycardia, or emotion leads to a transitory imbalance. This condition is called demand ischemia and is responsible for most episodes of chronic stable angina. In other situations, the imbalance is caused by acute reduction of oxygen supply, secondary to marked reduction or cessation of coronary flow, as a result of platelet aggregates or thrombi. This condition is called supply ischemia and is responsible for myocardial infarction and most episodes of unstable angina.
Angina, or chest pain and discomfort, is the most common symptom of CAD. Angina can happen when too much plaque builds up inside arteries, causing them to narrow. Narrowed arteries can cause chest pain because they can block blood flow to your heart muscle and the rest of your body. Other symptoms include weakness, discomfort in the arms or shoulders, cold sweat, shortness of breath, and symptoms of heart attack. A completely blocked coronary artery will cause a heart attack. The classic signs and symptoms of a heart attack include crushing pressure in your chest, pain in your shoulder or arm, sometimes with shortness of breath and sweating.
There are several ways that you can use to diagnose CAD. 1. Electrocardiogram or ECG. An electrocardiogram records electrical signals as they travel through your heart. Also, ECG can often reveal evidence of a previous heart attack or one that's in progress. 2. Exercise stress test. If your signs and symptoms occur most often during exercise, ECG will be done when the patient walks on a treadmill. Sometimes, an echocardiogram is also done while you do these exercises. This is called a stress echo. In some cases, medication to stimulate the heart may be used instead of exercise.
3. Echocardiogram. An echocardiogram uses sound waves to produce images of the heart. During an echocardiogram, the doctor can determine whether all parts of the heart wall are contributing normally to the heart's pumping activity. Parts that move weakly may have been damaged during a heart attack or be receiving too little oxygen. This may be a sign of coronary artery disease or other conditions.
4. Nuclear stress test. This test is similar to an exercise stress test but adds images to the ECG recordings. It measures blood flow to the heart muscle at rest and during stress. A tracer is injected into patient bloodstream, and special cameras can detect areas in the heart that receive less blood flow. 5. Cardiac catheterization and angiogram. During cardiac catheterization, a catheter is gently injected into an artery or vein in the groin, neck, or arm and up to the heart. X-rays are used to guide the catheter to the correct position. Sometimes, dye is injected through the catheter. The dye helps blood vessels show up better on the images and outlines any blockages. If patient has a blockage that requires treatment, a balloon can be pushed through the catheter and inflated to improve the blood flow in the coronary arteries. A mesh tube or stent is typically used to keep the dilated artery open. 6. Cardiac CT scan. A CT scan of the heart can help the doctor to see calcium deposits which can narrow the arteries. If a substantial amount of calcium is discovered, coronary artery disease may be likely. A CT coronary angiogram, in which patient receives a contrast dye that is given by IV during a CT scan, can produce detailed images of the heart arteries.
Now I will talk about treatment of CAD. Treatment for coronary artery disease usually involves lifestyle changes, and if necessary, drugs and certain medical procedures. Lifestyle changes include quit smoking, eat healthy foods, exercise regularly, lose excess weight, and reduce stress. Various drugs can be used to treat coronary artery disease, including 1. Cholesterol-modifying medications including statins, niacin, fibrates and bile acid sequestrants. These medications reduce or modify the primary material that deposits on the coronary arteries. 2. Aspirin. This can reduce the tendency of patient blood to clot, which may help prevent obstruction of your coronary arteries. If patient has had a heart attack, aspirin can help prevent future attacks. But aspirin can be dangerous if you have a bleeding disorder or patient is already taking another blood thinner, so medical history is important. 3. Beta blockers. These drugs slow the heart rate and decrease blood pressure, which decreases heart's demand for oxygen. Also, if patient has had a heart attack, beta blockers reduce the risk of future attacks. 4. Calcium channel blockers. These drugs may be used with beta blockers if beta blockers alone are not effective, or instead of beta blockers if you're not able to take them. These drugs can help improve symptoms of chest pain. 5. Ranolazine. This medication may help people with chest pain and angina. It may be prescribed with a beta blocker or instead of a beta blocker if patient can't take it. 6. Nitroglycerin. Nitroglycerin tablets, sprays, and patches can control chest pain by temporarily dilating the coronary arteries and reducing heart's demand for blood. 7. Angiotensin-converting enzyme ACE inhibitors and angiotensin II receptor blockers ARBs. These similar drugs decrease blood pressure and may help prevent progression of coronary artery disease.
Sometimes more aggressive treatment is needed to restore and improve blood flow, such as 1. Angioplasty and stent placement. It's also called percutaneous coronary revascularization. A catheter is inserted into the narrowed part of patient artery. A wire with a deflated balloon is passed through the catheter to the narrowed area. The balloon is then inflated, compressing the deposits against your artery walls. A stent is often left in the artery to help keep the artery open. Most stents slowly release medication to help keep the arteries open. 2. Coronary artery bypass surgery. A surgeon creates a graft to bypass blocked coronary arteries using a vessel from another part of the body. This allows blood to flow around the blocked or narrowed coronary artery. But because this requires open heart surgery, it's most often reserved for people who have multiple narrowed coronary arteries.
Thank you for watching. Please subscribe the channel and wait for new videos.